over 1 million bone fractures each year in the UK alone. Bone is a living tissue that is essential for protection of organs, maintenance of posture and movement, and also for the formation of blood cells and regulation of calcium levels within the body. When a fracture occurs, an orthopaedic doctor will take an X-ray of the bone fracture in question in order to assess the patient's condition and formulate the most appropriate line of treatment. As seen in this case, the patient's tibial fracture is relatively minor and only requires a plaster cast for approximately 10 to 12 weeks. So what happens physiologically when a bone fractures? Firstly, the blood leaks out of the vessels, causing a great deal of swelling around the fracture site, as seen in orange. Chemicals known as cytokines are released from the dead cells in order to initiate the process of bone healing. This forms a fracture hematoma. The blood clots and a meshwork of spongy tissue between the fracture fragments forms. This contains fibroblasts producing collagen fibres and also chondroblasts producing hyaline cartilage. This meshwork acts as a scaffold forming the soft callus. New blood vessels begin to form across the two fragments of the fractured bone at this point. The soft callus is replaced by bone callus. This is done by osteoblasts, which are precursor progenitor cells found in the periosteum, contributing to the synthesis of the new bone cells. The bone callus transforms into what is known as trabecular bone. This then develops into compact bone, which is the hard outer layer that gives the bone its smooth white appearance. This is known as the bone remodeling stage, where dead cells are broken down and reabsorbed by osteoclasts, and the osteoblasts continue to produce new bone cells.